Do you suffer Parkinson's disease? Has your body begun to slow down? Has it begun to slow down to where you can barely get out of a chair, to where you're walking in a very slow shuffle kind of walking pattern, and you just can't speed up? Has your body, your arms or the legs started to tremor? Is that happening with you? Is your posture even, your head maybe starting to tremor a little bit or major? My name is Dr. Lonnie Herman, and in this video I'm going to share with you exam findings of a patient who came to me from out of state, and he was diagnosed with Parkinson's disease a few years ago, and he just feels his body has been getting worse, and the medication that he's tried has not helped, the Parkinson's medication. Now, this today is June 17th of 2016. The first examination, which I did put up here on my YouTube channel. I'm going to show the first exam results and the second exam results and his progress in between from his second consultation. Okay, so in his first examination, I'm going to read through these pretty quickly, so just pay attention here, and you can pause this video and you can replay it, you can rewind it, you can replay it again, you can rewind it again, listen to these bits of information. In the first part of this video, I want to go pretty quick through the findings here because I already do have these results in another video on my YouTube channel. And the second part, I'm going to explain more and get into some other deeper into the nervous system tissues. And I will put labels of everything on the screen so you can read through and pause and write things down and so on. Okay? So, and by the way, share this video with one friend who suffers a tremor disorder, a movement disorder, a slowness of gait, a gait problem, a walking problem, a Parkinson's condition, because he or she and the family of that individual deserves to know there's other information, there's another way of figuring out what's going on, what's causing the disease, and removing the disease. Your body is supposed to work normal, and when there are toxins and there are infections that can hide in your nervous system tissues and your organs, your body can't function normally. And that is what causes the breakdown of the tissue function. That's what causes the malfunction. And the electrical devices around us, electromagnetic stressful factors, cell phones, Wi-Fi signals, cell phone towers, computers, tablets. These are all throwing out different kinds of electrical energy stresses to our nervous system and, can and will change the function of the nervous system. So in his first examination, I found problems with his parathyroid, and I will put the link to this video of the original one up here, so you can also go and watch that one as well after you watch this one. Parathyroid is chief gland in the entire endocrine system, which governs the level of calcium in the blood and in the tissues and the bones and so on. And you need calcium to help your brain function normal. His parathyroid was, and let me tell you before I even get into this, his teeth were already handled by a biological dentist, and he had all the mercury removed a couple of years before I ever met him. Okay? And his problem is still progressing, getting worse. So I found that his parathyroid infection from the tooth. I found cell phone radiation in the parathyroid, dental mercury, silver in mercury. I found nanobacteria. I found chlorine, detergent bleach. I found Candida tropicalis. I found antibiotics like Cipro and erythromycin in there. I found toxic mold in his parathyroid. I found an antibiotic, a fluoroquinolone known as Levaquin. I found in his hemoglobin damaging his red blood cell where the oxygen exists in the hemoglobin. I found dental mercury, silver mercury, and a mercury dimethyl mercury, very toxic, very bad one. I found in the kidney that he has some calcifications in the kidney. I found in his spleen that he had dental mercury and mercury dimethyl methyl chloride. I found silver mercury. I found two other kinds of mercury in his spleen. I found other antibiotic residues in his spleen. Removing them, making precision, accurate remedies that remove all of these infections and toxins from the specific tissues. Watch the other video, I'll go more into detail. I found in his aorta anesthesia chemicals. The man had had 2 hernia operations where they had to put him to sleep, and he had a shoulder rotator cuff operation. They had to put him to sleep. So anesthesia chemicals are neurotoxic substances. Look it up online. Very simple, at the World Wide Web with your fingertips. You can search using Google or some other search engine, and you can find neurotoxic effects of anesthesia. Look it up yourself, and I'll even put some information on the screen here so you can do that, okay? In his carotid arteries, which go up the front of the throat, which bring blood to about the front 3/4 of the brain and some internal parts of the brain, but not the part of the brain stem which makes your dopamine, by the way. Dopamine is made in the substantia nigra, which is, we're talking about the upper brain stem. So the carotid artery supplies other blood vessels known as the cerebral arteries, and they go through parts of the brain that don't involve the brain stem, where dopamine is made. So carotid arteries, candida glabrata, anesthesia chemicals. I found in the cerebral arteries, I found Candida tropicalis, more Candida glabrata. Candida is a yeast-like fungal infection, inflaming the brain, damaging the brain. I also found a Candida albicans in his cerebral artery, and I further found anesthesia chemicals in his cerebral arteries. So Candida in the brain can't allow the brain to function. Okay, it's going to be inflammation. It's going to destroy the absorption of certain neurochemistries like dopamine. It's going to destroy the production of certain neurochemistries like GABA and serotonin. And it's going to not let us function okay. If you have Candida in your brain, blood vessels in your brain, it's like having a strep throat. You've ever had a strep throat? You ever have a sore throat because there's a bacterial infection in your throat? Streptococcus bacteria, also known as strep throat. Well, what if the infections like a strep or a Candida or a fungus or a mold or something gets into the blood vessel in the brain? Do you think it's going to let your brain function okay? If you can't swallow okay when you've got a strep throat, how is your brain going to function okay when there's infection in the blood vessel in the brain? Makes sense, I hope. I found in another blood vessel, which is right at the base of the brain, called the Circle of Willis, I found that he had a dimethylmercury in there, poisonous toxic mercury. I found that the veins which drain the brain of carbon dioxide, drain the brain of lactic acid, draining the brain of any kind of infection and toxin. The veins are the blood vessels that take the blood out of the brain. Arteries bring it to, veins away. In his veins, I found a very, very high level of Candida albicans, yeast-like fungal infection. I found Candida tropicalis in his veins. And then in the back of our neck, we have an artery known as the vertebral artery. So we have 2 carotids, one on the left and one on the right in the front. Well, we really have 2. We have internal and external carotids, but we have the carotids in the front. And we have vertebral arteries that run up inside the vertebrae, inside your spinal column, inside the bones of your neck. You have vertebral arteries on the right and on the left. The vertebral arteries come up and they branch into like an upside down V. And there's an artery that comes off of this artery, of these 2 arteries. It's called the basilar. So 2 vertebral become 1 basilar artery. And the basilar artery has arteries that go right into the brainstem where the dopamine is made. And then that basilar artery has branches of other cerebral arteries which go to your cerebellum and go to the back of the brain and internal parts of your brain. Okay? Stop it, pause it, rewind it, listen to that again. His basilar artery showed a very high level of neurotoxic substances known as anesthesia. Anesthesia chemicals, and I won't get into the particular name, but the anesthesia chemicals are neurotoxic inside the basilar artery, and that artery is the artery that sends blood with oxygen to your brain stem where the dopamine is produced. How can this man's brain stem do what it's supposed to do by making the dopamine when there's infection and toxin in the blood vessels there? Hopefully that's starting to make sense. You can't function okay when you get a sore throat because of a bacteria in your throat. Your brainstem can't function okay when there's a bacteria or a chemical like anesthesia that's in the tissue and in the blood vessel feeding the oxygen and blood to the tissue, so it can't make enough dopamine. So don't take dopamine, fix what's in there, clean it out. Now, He comes back to me. That was on April 26th. He comes back into my clinic. June 13th, I examine him again in the consultation. Sometimes things get better. Sometimes a lot of symptoms, some, 1, 2, 3, can stay the same from one protocol to the next. And maybe a symptom did get a little bit worse. So his vocal cords, his voice, he had to work a little harder to speak. But, and I think maybe there's some mercury that's there that we have to clean up. But what happened, what was the positive, is that his diarrhea that he's had ever since he's, well, from 10 till about 13 or so, 10 to 12 or 13, he had diarrhea. Then it went away. Then it came back, and he's had it for a good part of his adult life. Diarrhea on a very regular basis. Taking a certain over-the-counter anti-diarrhea medication, which confuses the nervous system, gets the nervous system toxic, and which I found this in him, and the diarrhea persisted up until he did this protocol. So we have no diarrhea. He said it diminished. That was his word. Diarrhea diminished. Diarrhea diminished from this protocol. That's a great step. It's a great step. We had to clean out some tissues. We have to get those clean because that was what was important for his body. I do things in an order of importance. What's the priority? What's the first degenerative organ? What's in there? 1, 2, 3, 4, 5, 20, 25 different infections and toxins, maybe, diseasing that degenerative organ before we can go on to organ number 2 or tissue number 2. Well, on this exam, get ready, hold on, because there's a very long list here, a very long list. And listen, I have tissue samples of the anterior part of the spinal cord, of the motor neuron, of the posterior spinal cord, of different parts of the brain, of the substantia nigra, of the basal ganglia, dopamine parts of the brain. I've got different nerves. I'm able to actually do a stress reflex testing, a bioresonance stress reflex test, where I can find within seconds, is a tissue diseased or not? Is it stressed or not? Is it under a degenerative strain or not? His anterior spinal cord, electricity. His anterior spinal cord, and something else I discovered in this man's consultation, was that he had chronic sinusitis for years and took one of the commonly advertised on every store shelf, over-the-counter, self-prescribed, allergy, sinusitis type of breathing better, stopping the histamine, over-the-counter medication for $10 or less in your local store. I found that, and I won't mention the name here because I'm not going to bash any company. I'm just going to tell you that the active ingredient that's in this over-the-counter anti-sinus, anti-inflammatory, antihistamine medication was in his anterior part of his spinal cord. The active ingredient, and I'll put that name up on the screen. I have it in my notes somewhere. I'm sorry, not right now, but I'll put that name up on the screen. The active ingredient has been found, and I'll put up an article from PubMed, a published medical journal site. PubMed, they found that this ingredient caused tremors. The ingredient, the active ingredient, caused tremors in the study. I found a stuffy head, fever, so you can rest, no coughing, medicine, over-the-counter, helps you sleep. It really can put you to sleep. Over-the-counter medication. The active ingredient is toxic. I found this over-the-counter medication damaging the anterior spinal cord. I found another over-the-counter medication, another stuffy head so you can stop fever so you can rest, and no coughing and no sniffling and so on medication in his anterior, poisoning, toxifying his anterior part of his spinal cord. Motor control is anterior spinal cord. Motor, moving your arms and legs, moving your fingers, anterior part of the spinal cord. I found an anti-diarrhea, common over-the-counter, toxic, another toxic active ingredient which confuses the nervous system. When you have diarrhea and you stop it, you're confusing your nervous system. The diarrhea is for a reason. Maybe you have a parasitic infection in your intestines. Maybe you have an infection somewhere else that's making your body so stressed that you have diarrhea. Maybe it's not an intestinal problem, but it's causing an intestinal disturbance because there's an infection in your spleen, or an infection in your kidney, or an infection in your pancreas, and you get diarrhea. Or an infection in the spinal cord and you get diarrhea. So you take an anti-diarrheal because the chemical stops the nervous system from doing what it's supposed to do, and it gets absorbed into that nervous system tissue. So take it once, take it twice, take it 3 times, take it a dozen times or 24 times, and you are poisoning that nervous system, confusing it from what God, Mother Nature, whatever you believe in, has told your nervous system to be able to do when it gets stressed by something, a diarrhea pattern. You got to figure out why you got the diarrhea. Not just confuse the nervous system. Well, I found that active ingredient poisoning his anterior spinal cord. I found painkillers, oxycodone, painkiller that he's had for 2 hernia operations. He's had it for a shoulder rotator cuff surgery. Oxycodone poisoning his anterior spinal cord. The mosquito spray, it's got DEET, D-E-E-T. You spray this when you go in the woods. He grew up in a very midwestern state in the United States, where he visited my clinic in Florida from. DEET is toxic. If it's going to kill a mosquito, what do you think happens if it repels the mosquito because it's poisonous and it soaks right into your skin and gets into your bloodstream, and you breathe in the chemical when you spray it? I know because I've done it in the past until I know what it is. Now I know what it is. I found this, I won't even say, I found this DEET chemical, poisonous chemical, damaging his anterior part of his spinal cord. I found chlorine, detergent, bleach detergent, fumes from that damaging his anterior part of his spinal cord. Whether it came from swimming in a swimming pool that was chlorinated, or used in a bathroom, or in the tub when he took a bath because there's chlorine in the water, or in the shower, or in a water fountain that he drank chlorinated water from, that chlorine bleaching detergent in his anterior spinal cord. I found one of the erectile dysfunction, Viagra, damaging the nervous system. I found residues of that in his anterior spinal cord. I found a homeopathic, so we called it, a holistic, a herbal, erectile dysfunction substance in his anterior spinal cord. I found dental mercury in his anterior spinal cord. It wasn't the first one. It was down the list here, as you see. I found antibiotic residues damaging his spinal cord. I'll put up another British Journal of Pharmacology. You'll read that one. You deserve to know. I found anesthesia chemicals in the anterior spinal cord at an alarming amount. I found a common non-steroidal anti-inflammatory over-the-counter medication in his anterior spinal cord, damaging the anterior spinal cord, making the arms move slower, making his legs move slower. He can't play his favorite sport. He can't do so many things. Very nice man. His body is slowing down so terribly that it's like he's very stiff. Not like it is. I found a very harmful fluoroquinolone antibiotic, 2 of them. One was called Levaquin in his anterior spinal cord. I'm making remedies to get that toxic Levaquin antibiotic out of his anterior spinal cord, to let that spinal cord to breathe and do what it's supposed to do to stop the damage. Also the Avalox, the same thing, Avalox, fluoroquinolone antibiotic, tons of proof of how damaging these are, whether he was prescribed this antibiotic or the antibiotic was fed to a cow and he had hamburger meat, or fed to a chicken and he had the egg or the chicken breast. They're feeding these antibiotics to animals, they're giving it to patients. In either way, it's causing damage. You may not have been prescribed it, you never take an antibiotic, but you don't eat organic raised animal if you're not a vegan. Even if you are a vegan now and you are a vegetarian now and you used to eat meat, you absorb these toxins, your body never let it go. Just because you pooped out what you pooped out, your body absorbed the chemical, and the side effects of that chemical have damaged your tissues over time. I found a very dangerous bacteria known as Anaplasma in his anterior spinal cord. I found the Lyme infection, Borrelia burgdorferi, damaging his anterior spinal cord. I found the morphine medication, post-surgical morphine medication in his anterior spinal cord. I found tetracycline, damaging antibiotic. You don't believe it, you might be okay, or you've got a loved one with Parkinson's, but you've taken it before and it hasn't affected you as Parkinson's. Read the journal that I'm putting on the screen. You deserve to know the real results, the real reports about these antibiotics. Next tissue in the second priority level of tissue degeneration that I had to work with was his entire brain, and I found in there a very high level of the DEET mosquito spray chemical in his brain. Then what came up was his posterior spinal cord. The same DEET anti-mosquito spray chemical, the same 2 different kinds of the coffee, runny nose, no fever, so you can sleep, so you can rest medicine overnight. I found 2 different ones over the counter with toxic chemicals in them. The active ingredient changes the function of your immune and nervous system, people. Doesn't mean it's okay for you. Yes, I understand when you get a runny nose or you can't sleep and you take something, but these poisons add up over time. In some cases, very quickly can cause a problem. In some cases, over time of chronic use of them, that you're going to get a nervous system deterioration. Well, further, I found the levaquin in his posterior spinal cord. I found the anesthesia chemicals in the posterior spinal cord. I found the morphine, the tetracycline, the anti-diarrhea medication in a very high level, more than what was in his anterior spinal cord, damaging his posterior spinal cord. I made remedies for all of these findings so far, which will, with precision, following like cures, like homeopathic understanding. These are precise, exact duplicate copies of the infection, toxin, and tissue that we're working on. So we can go right in there, perfectly programmed to just pull that toxin right out and patch up, repair the tissue. I found in the next 3rd tissue, which was diseased in his body that needed help right away, was his basal ganglia. We're talking movements, we're talking dopamine, tissue in the brain. The same mosquito spray, the same anesthesia chemicals, the same over-the-counter in a much higher level. This over-the-counter stuffy head fever so you can rest medicine was in one like it that's under a different name than what you might be thinking, in his basal ganglia at a very, very, very big, damaging, very toxic amount. I found dental mercury damaging his basal ganglia. I found cefdinir, the generic of cephalosporin antibiotic, damaging, straining, stressing his basal ganglia. I found another over-the-counter anti-inflammatory stuffy head fever, so you can rest kind of medicine, liquid form in his basal ganglia, damaging it. Tetracycline antibiotic, damaging his basal ganglia. And then in the frontal lobe, which also controls motor functions, I found again another high level of the stuffy head, no fever, so you can rest, so you can breathe, no coughing medication. These toxic chemicals, and there may be even more in these tissues that have to be dealt with, but he has taken so many of these toxic chemicals over the years for a runny nose, for sinusitis, for chronic diarrhea, and maybe a fever here and there, and maybe a strep throat here and there, and maybe a flu type thing here and there. It wasn't vaccines. It wasn't Lyme that was the biggest deal. It wasn't whatever you think. You heard these are accurate, precise examples, findings, let me say, examples of what could be in you, but findings exact of this gentleman who is, I believe he's in his 50s, with a Parkinson's-like, a movement disorder, a Parkinson's-like condition. I will see him again in about a month and a half, and I look forward to some progress with him. I know he does too, and his wife does too. We've got to peel away the layers with these chronic conditions. He's built these toxic effects up over time, and there may be other critters, infections like strep and Lyme and viruses, and maybe some vaccine chemicals that are also in these tissues that we have to get out. But these were in a priority order. We're going to get these out, and I do hope that he improves right here. But he will improve, and there's no way you can't improve, and there's no way that he can't improve when you find with precision exactly what toxin and infection is there and remove it safely, effectively, elegantly. Remove those infections and toxins and repairing the nerve tissue at the same time. That is what I do. Share this video with one friend, just one person. Take out your cell phone, press the if you're watching this online on your cell phone, hit the share button and send it to someone. If you're on your computer, just click share this with an email from YouTube and send it to someone. People need to know that there are ways, that there are answers, there are causes of the chronic disease. Even if you want to donate your money to some foundation because you think that they're going to find a cure, you can't get cured with one magic bullet, pill, or stem cell treatment when you've got these poisons and infections in your brain, in your blood vessels. They have to be dealt with. Because if you've got a lead weight tied to your neck and it weighs 150 pounds, you're not going to move no matter how many stem cells, no matter how many steroid injections, no matter how many vitamins you take. You've got to remove the big lead weight that's stuck to your neck. And let's say you got another lead weight stuck to your leg, your left leg. You got to remove that one too. You understand? Once you can get rid of the ties that bind you, you can get your symptoms to calm down and reverse your disease. My name is Dr. Lonnie Herman. I've got extensive training in functional neurology, neurochemistry, neuroimmunology, endocrinology, cardiology, internal cancer, internal medicine, cancer. It's what works. That is it. We are after what gets results, and this will get the results. This is what I do. I can find what's in the tissue and help you remove it and repair it. Call my clinic. For those of you who are ready to form a consultation appointment, ready to set your first exam here, a dental exam, because teeth can be part of your problem, my first protocol development exam, finding the weakest tissue and what's causing it to be weak and degenerative and fixing it, my inventory type scan where we can scan multiple tissues in your body and tell you exactly what's causing the damage in those tissues, what kind of infections and toxins. When you call my clinic, 954-370-3100, my assistant Anna, she's delightful, she'll answer the phone, she will help you. She doesn't have the answers for you of how exactly I'm going to figure things out. That is what we're going to discuss in a consultation. She doesn't know exactly what I'm going to ask you in the consultation. That's not her job. Her job is to schedule an appointment for us. I've got to dig in the consultation and find out what links have led to your individual tremoring and movement disorder condition. Call it Parkinson's or call it one of the other 100 kind of movement disorders that exist in neurology textbooks. That's right, not all are called Parkinson's. Like my Facebook page, like it, and subscribe on my YouTube channel. I put up new videos here all the time. Okay? Let me tell you this. Medicare, Medicaid, workers' comp, regular insurance companies do not recognize HMO, PPO. They don't recognize my work. They don't do this. They don't understand it. They'll prescribe the antibiotic. They'll prescribe the Cinemet. They'll prescribe the L-Dopa or carbidopa, and that's it. And they'll watch you deteriorate. They pay for that. They don't cover this. So be prepared with my assistant when you call and you speak with her. This is out of pocket. It is fortunate that we can do this because you can finally start to figure out and unravel what's causing your individual condition, and not only find what it is, find exactly where that poison is and find out exactly where and how bad that infection is and get rid of it. The blood labs, the hair labs, the urine labs, the stool labs, they're not going to find these. I've done them before. I've done them all, and they don't get the answers and they cannot provide the results that I'm going to help you provide for yourself. Call my clinic at 954-370-3100.